In this video, we will introduce the Engage HF app and provide an overview of its different features and functions. The Engage HF app is designed to make it easier to get on the best combination of medicines that aim to help you live longer and healthier. In addition, you can track your vitals and health status over time to help you be more engaged in your heart failure care. When you first sign in, you will be asked to choose a time of day to receive your daily notifications. You can also set up alarms for your heart medications at different times throughout the day. Now, it's time to connect your Omron blood pressure cuff and weight scale with the app. You need to install the Omron app on your phone and allow the sharing of data between the two apps. On the main dashboard, you can see your tasks for the day at the top. These tasks include your daily check-ins and 2-week check-ins. During your daily check-in, you will provide information about your health status and whether you took your medications the previous day. The daily health status assessment asks you to describe how you felt the day before regarding your heart symptoms like leg swelling, dizziness, and shortness of breath. You can choose a rating from very poor, red, to poor, good, and very good, green. The medication adherence question asks if you took your heart failure medication the previous day. This helps you track your medications and see how they relate to how you feel. The dashboard also includes a notification box where you can find your daily notifications and tasks for the day. The app also has an engagement score that measures how actively you use it. Your score increases as you complete app activities like answering the daily health status question, reporting medication adherence, and checking your vitals. The more you use the app, the higher your engagement score will be. When you click on the engagement score, you can see two different views. The weekly view records your daily activity, while the monthly view shows your engagement over the entire month. If you forgot to enter vitals from prior days, you can also add them manually on this page. Underneath the dashboard, you can view the most recent vital measurements, medication score, and KCCQ-12 scores. Additionally, if your weight has increased since the last measurement, you will see a warning arrow next to the weight value. Now let's look at inside the app. You will find 3 main pages inside the app: Vitals, Health Status, and Medication.
On the Vitals page, you can view your blood pressure, heart rate, and weight measurements. You can choose to connect your phone to the Omron app for automatic data entry, or you can manually add your vitals in the app. You can select to see your vitals for the past 30 days, weekly, or monthly averages. In the Health Status page, we use 3 tools to monitor your heart failure symptoms: the Kansas City Cardiomyopathy Questionnaire 12 or KCCQ-12, the Dizziness Questionnaire, and the Daily Health Status Question. The KCCQ-12 is a set of 12 questions that assess how heart failure affects your symptoms and quality of life over the last 2 weeks. Your responses to the 12 questions lead to scores in 4 different categories and an overall score that averages those 4. Each score goes from 0 to 100, with lower scores meaning major limitations related to heart failure and 100 indicating minimal limitations related to heart failure. The Engage HF app reminds you to answer these questions every 2 weeks to track your progress and see if you are getting better or if you need more attention. Besides the speedometers, you can also monitor the trend of your health status through a graph format in the app. To better understand changes in dizziness over time, the Engage HF app asks 2 questions about the frequency and severity of your dizziness every 2 weeks. We then score your response between 0 and 100, with 100 meaning no dizziness and 0 meaning very severe frequent dizziness. In addition to doing the KCCQ-12, the Engage HF app asks you each day how you felt the prior day in terms of your heart symptoms. This is part of your daily check-in and less detailed than the KCCQ-12, but gives a quick picture into how you feel between your 2-week surveys. This can help identify if you start feeling worse and can also help you and your clinical team see if how you felt is related to the weight or blood pressure you check each day. In the medication page, you can find detailed information about your core heart failure medications. There are 4 main types of heart failure medications: beta blockers, renin-angiotensin system inhibitors such as ACE inhibitors, ARBs, and sacubitril/valsartan, mineralocorticoid receptor antagonists, and SGLT2 inhibitors. On this page, you can see the current dose, target dose, and progress towards reaching your target dose of these medications. In the Engage HF app, We've introduced a visual representation to help you easily understand your medication status. Each medication is represented by a colored circle with a symbol inside. Let's break it down. Green circle with a check mark. This indicates that you are at the target dose for that medication. Congratulations! Yellow circle with an upward arrow. This means you are eligible to increase the dose of that medication. Consult with your healthcare provider for further guidance. Gray circle. This signifies that you are not currently prescribed that class of medication. Furthermore, we use different degrees of the circle to represent how your dose compares to the general target dose we aim to achieve. For example, a full circle means you are at the target dose, and the circle can be divided into segments to show the progress in increments of 25%, 50%, or 75%. The app also provides a personalized heart failure med score to help you track your medication usage. This score ranges from 0 to 100, with 100 indicating that you are on the best possible treatment for your heart failure using the 4 medication classes mentioned earlier. A score of 50 means there is room for improvement in your medication regimen, and working with your care team can help lower your risk. Your score will change over time as your meds change and as we collect more information about your vitals. On the medication page, there is a section specifically for diuretics. Your clinical team will give you instructions on how to respond to sudden weight gain of 5 or more pounds. They may suggest increasing your water pill dosage or advise you to contact them for further assistance.
At the top right of your dashboard, there is a menu button. This includes different options like General Account Settings, Notification Settings, Medication Alarms, Health Summary, Educational Resources, and Contact Information. In the account settings, you can access your account information. You have the option to disconnect the app from your Omron account, change your password, or sign out of your account. In the notification settings, you can customize which notifications you receive for each task. You can also set alarms or change existing alarms for your medications. The Health Summary feature gives a complete overview of your vitals, health status scores, and medications for your visits. You can also write down any questions you want to ask your clinicians. You can create a PDF of the summary and easily share it with your healthcare providers or caregivers.
The Engage HF app offers short educational videos on how to use the app, heart failure medications, and heart failure monitoring. These videos, based on information from heart failure experts and recommendations from the American Heart Association and the Heart Failure Society of America. The educational videos about heart failure medications provide insights into how the medications work, their benefits, and possible side effects. The videos related to heart failure monitoring explain why it's important to keep track of vital signs, weight, and overall health status. The app's videos also demonstrate the features of the app, including how to understand the medication checklist and the medication score. If you have any questions about the app, you can contact us through email. You can also visit our website for additional educational content.
Don't forget to subscribe to our YouTube channel.
Hello everyone, I want to emphasize how the Engage HF app can truly make a difference in your life. The app helps you better understand the goals of medicine treatment and how to get on the best heart medicines for you. This can make you a more active partner with your healthcare team and help you live a healthier and longer life.
Welcome everyone. This app empowers you to take control of your heart failure management. By tracking your vital sign, weight, and health status, the app provides valuable insight into your condition. You can identify trends, detect early warning signs, and share this information with your healthcare team. Let the Engage HF app be your guide on this journey to better health.